Aneurysm, subarachnoid hemorrhage. Definition. A subarachnoid hemorrhage or subarachnoid hemorrhage in British English is bleeding into the subarachnoid space, the area between the arachnoid membrane and the pia mater, surrounding the brain. This may occur spontaneously, usually from a ruptured cerebral aneurysm, or may result from head injury.
This is Dr. Cal Shifley with a review of the circle of Willis, Berry aneurysms, and subarachnoid hemorrhage in the brain. To begin, let's take a look at the anatomy of the circle of Willis. Higher blood flow to the brain. Posterior communicating and anterior communicating arteries complete the circle. By merging the inflow of Willis, let's take a look at how it distributes a wall. Arteries which carry very high flow may occur, and is most likely vasospasm occurs as a result of chemical irritation of blood vessel walls by breakdown products of hemorrhage.
Symptoms of SAH include a severe headache with a rapid onset, vomiting, confusing or a lower level of consciousness, and sometimes seizures. The diagnosis is generally confirmed with a CT scan of the head, or occasionally by a lumbar puncture. Treatment is by prompt neurosurgery or radiologically guided interventions with medications and other treatments to help prevent recurrence of the bleeding and complications. Surgery for aneurysms was introduced in the 1930s. SAH is a form of stroke and comprises 1 to 7% of all strokes. It is a medical emergency and can lead to death or severe disability, even when recognized and treated at an early stage. Up to half of all cases of SAH are fatal, and 10 to 15% of casualties die before reaching a hospital, and though symptom of subarachnoid hemorrhage is thunderclap headache, a headache described as like being kicked in the head, or the worst ever, developing over seconds to minutes. This headache often pulses towards the occiput, the back of the head. About 1/3 of sufferers have no symptoms apart from the characteristic headache, and about 1 in 10 people who seek medical care with this symptom are later diagnosed with a subarachnoid hemorrhage. Vomiting may be present and 1 in 14 have seizures. Causes. Most cases of SAH are due to trauma. In 85% of cases of spontaneous SAH, the cause is rupture of cerebral aneurysm, a weakness in the wall of one of the arteries in the brain that becomes enlarged.
The type that we're most interested in is spontaneous subarachnoid, versus otherwise healthy and and sucking my dick so terrible. But I gotta let her bleed and that happens after 15 minutes and the correlates and be struck by a ruptured aneurysm. Main symptom is a severe headache, worse headache that a person has ever had in their life. Usually they're feeling a headache called DCI or delayed.
Diagnosis. Imaging. The initial steps for evaluation, a person with a suspected subarachnoid hemorrhage are obtaining a medical history and performing a physical examination. These are aimed at determining whether the symptoms are due to SAH or to another cause. Lumbar puncture. Lumbar puncture, in which cerebrospinal fluid is removed with a needle from the lumbar SAC, will show evidence of hemorrhage in 3% of people in whom CT was found normal. Lumbar puncture is therefore regarded as mandatory in people with suspected SAH if imaging is negative. Angiography. After a subarachnoid hemorrhage is confirmed, its origin needs to be determined. If the bleeding is likely to have originated from an aneurysm as determined by the CT scan appearance, the choice is between cerebral angiography, injecting radio contrast through a catheter to the brain arteries, and CT angiography, visualizing blood vessels with radio contrast on a CT scan. Treatment. Management involves general measures to stabilize the patient while also using specific investigations and treatments. These include the prevention of rebleeding by obliterating the bleeding source, prevention of a phenomenon known as vasospasms, and prevention and treatment of complications.